If you feel unwell, stay at home and call your doctor. She or he will ask questions about your symptoms, where you have been and who you have had contact with. This will help to make sure you get the right advice, are directed to the right hospital, and will prevent you from infecting others. If you are sick, stay at home, and eat and sleep separately from your family. Use different utensils and cutlery to eat. If you develop shortness of breath, call your doctor and seek care immediately. Before putting on a mask, clean hands with alcohol-based hand rub or soap and water. Cover mouth and nose with mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. Replace the mask with a new one as soon as it is damp, and do not reuse single-use masks. To remove the mask, remove it from behind. Do not touch the front of mask. Discard immediately in a closed bin. Clean hands with alcohol-based hand rub or soap and water. Clean your hands regularly with an alcohol-based hand rub, or wash them with soap and water. Touching your face after touching contaminated surfaces or sick people is one of the ways the coronavirus can be transmitted. Protect yourself and others from getting sick after coughing or sneezing. When caring for the sick, before, during and after you prepare food, before eating, after toilet use, when hands are visibly dirty, after handling animals or animal waste. Clean surfaces regularly with disinfectant, for example kitchen benches and work desks. Does putting on sesame oil block the new coronavirus from entering the body? No, sesame oil does not kill the new coronavirus. There are some chemical disinfectants that can kill the 2019 nCoV on SU faces. These include bleach, chlorine-based disinfectants, ether solvents, 75% ethanol, peracetic acid and chloroform. However, they have little or no impact on the virus if you put them on the skin or under your nose. It can even be dangerous to put these chemicals on your skin. Educate yourself about 2019 nCoV. Make sure your information comes from reliable sources, your local or national public health agency, the WHO website, or your local health professional. Avoid traveling if you have a fever or cough, and if you become sick while on a flight, inform the crew immediately. Once you get home, make contact with a health professional and tell them about where you have been. If you cough or sneeze, do it into your sleeve, or use a tissue. Dispose of the tissue immediately into a closed rubbish bin, and then clean your hands. If you are 60 plus, or if you have an underlying condition like cardiovascular disease, respiratory condition, diabetes, you have a higher risk of developing severe COVID-19. You may wish to avoid crowded areas or places where you might interact with people who are sick. If you are healthy, you only need to wear a mask if you are taking care of a person with suspected 2019 nCoV infection. Wear a mask if you are coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. If you wear a mask, then you must know how to use it and dispose of it properly. Wash your hands frequently, regularly and thoroughly. Clean your hands with an alcohol-based hand rub or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Maintain social distancing. Maintain at least 1 meter 3 feet distance between yourself and anyone who is coughing or sneezing. If you have fever, cough and difficulty breathing, seek medical care early. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek medical attention and call in advance. Follow the directions of your local health authority. Why? National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections. Avoid touching eyes, nose and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and can make you sick. Practice respiratory hygiene. Make sure you, and the people around you, follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Why? Droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. It's normal and understandable to feel anxious, especially if you live in a country or community that has been affected. Find out what you can do in your community. Discuss how to stay safe with your workplace, school, or place of worship. Be ready for coronavirus. Be safe from coronavirus infection. Be smart and inform yourself about it. Be kind and support one another. Like and share information for a better world.